Hello, I'm Dr. Kushal Hippalgaonkar, consultant orthopedic surgeon at Sunshine Hospital, Hyderabad. I specialize in joint replacement surgeries and arthroscopy surgeries, that is keyhole surgeries mostly around the knee joint. Robotic surgeries is also one of my specialties. Today I have with me a special guest, a patient, and who also happens to be family. Her name is Mrs. Sharmila Deshmukh. Mrs. Deshmukh came to me around 6 months ago with knee pain, and it was diagnosed as osteoarthritis of the knees, and she underwent robotic bilateral total knee replacement for the same. So let's talk to her about her journey of knee pain, surgery and post-surgery rehabilitation. So Mrs. Deshmukh, when did your knee pain actually start?
It started around 8 years back. Initially it was only one leg, the right one. Then slowly the left one also started. Then nearly about 2 years back, I was totally restricted from walking.
Yes.
Or even standing for a long time. I used to avoid going out.
Yes.
Because everywhere you have to walk.
Correct. So it kind of crippled your lifestyle.
Yes.
Okay. So what made you actually come and see an orthopedic surgeon for the same?
No, I was in such a pain, so I thought that it is time that I should consult an orthopedic surgeon.
So I think we met in the month of December.
Yes. Then I was diagnosed with osteoarthritis stage 4.
Yes.
And there was no other go except for the surgery.
Correct.
So then we also decided to go for the surgery.
Yes.
And you advised for robotic surgery,
Yes.
which is going to be more easily recovered.
Correct.
So we went for it. Operated on the 2nd of
Correct.
December.
Correct.
The first leg, and the second leg was on the 6th of December.
6th. Right. Just tell me, after the procedure, what kind of a rehabilitation did you go through?
In fact, I was made to walk the very next day in the post-operative ward.
Yes.
And the physiotherapy started immediately in the hospital.
Yes.
And I was provided a physiotherapist through the hospital itself, who is to come home every day for the physiotherapy. Excellent service given even by the physiotherapist. And this physiotherapy helped me a lot for my rehabilitation.
And in this initial 1 month, how bad was your pain?
There was a pain, but the feeling that I'll be walking without pain,
You're excited about it.
Yes. So I didn't experience that much of pain.
And do you remember when you left the walker?
It was exactly a month.
1 month. Okay. And then since then you have been
Without the walker. Then slowly I started walking for a longer period, like more number of times I started walking.
Right.
And then slowly I started small course of the house, like making tea or maybe making breakfast. Then after 3 months totally I started on my own. I started cooking. I asked the cook to leave.
Correct.
So
Okay. Now 6 months down the line.
yes, it's 6
How
months.
is the level of pain and
No, now there is walking, there is no pain at all.
pain? Yeah.
In fact, I went for a tour to Kashmir last 2 weeks back, and I walked with everyone.
Great. That's great.
And except a little slight stiffness sometimes, but I have no other problem at all.
Now your next stage is dancing. Right. So that's great to know. And now 6 months, I wish you a speedy recovery, whatever
Thanks a lot.
is left.
Initially, we were under the impression that this total knee replacement surgery could be done only after the age of 60, because maybe it doesn't work. But I was told by a lot of doctors from Sunshine Hospital, along with you, that age is not a factor. As soon as
this is when we want to live our life to the max.
Yes. We agreed for the surgery, and I went through the surgery, and I was given an excellent service from Sunshine Hospital too.
Thank you.
And you are an excellent doctor also.
I think that's pretty much the journey about knee replacement, from her outpatient visit to the surgical episode, and now post-surgery rehabilitation. So thank you so much for listening.
Sunshine, it's our sunshine.